Good evening. Welcome to another episode of Aging with Attitude. My name is Phil Koch. I'm your host this evening. We serve off of Channel 21, the greater Charlotte and surrounding market. Tonight we have some friends from Carolina's Home Medical Equipment, a DME provider, which we're going to discuss. We have Frank Trammell, the president and CEO. Welcome, Frank.
Thank you. Good to be here.
And we have Chad Vukolich, correct?
Correct.
And Chad is a senior sales or marketing representative for that company. Welcome to the show for both of you.
It's good to be here.
Pleasure's all ours.
Great. Well, let's get into it. Both gentlemen work for Carolina's Home Medical Equipment, and which is a durable medical equipment provider. And why don't you discuss to our viewers what that exactly means and the type of products and or services that you offer?
Okay. Really, the basis of our industry is to keep seniors independent and safe in their home. And we've got a host of different types of equipment that allow them to do that. Anything from bathroom safety, wheelchairs of all types, hospital beds, oxygen therapy, support surfaces for beds. I could go on and on, but that's what our industry does.
Right.
We're there to make the senior safer and more independent in their home.
Correct.
Now, their home could be an assisted living facility, but the idea is to keep them out of a nursing home
Right.
or the hospital.
So you would service people in retirement communities,
Yes,
could be a host of different types of retirement
Yeah.
communities, as well as their private residences.
absolutely.
Right.
And it's the complete gamut.
So if one of our family members, one of our viewers tonight had a family member or themselves needed DME, which stands for Durable Medical Equipment, that's an acronym in the industry,
Right.
equipment, they could pick up the phone and call you or ask a social worker to refer your company to them?
Yes, and we get referrals both ways.
Okay.
Typically, it is from a doctor's office or a social worker who is acting on behalf of that senior
Okay.
that is familiar with our industry. Let me just tell you, most people do not even know this industry exists until they have a need for it. And when I go to Washington to lobby our congressman, I'm typically talking to some 21-year-old staffer. They've got no idea,
Yeah.
unless they've got a grandmother that just had oxygen delivered to their home.
Right.
So it's a matter of education.
And it's not like other industries in that there's a lot of independent companies. For example, your company is independent, correct?
Yes,
A lot of those service the industry, correct?
correct.
Yeah.
Not nearly as many as there once was.
Right.
But it's still dominated, not just in Charlotte, but throughout the country with, we call it mom and pops.
Right.
But unfortunately now it's becoming more and more dominated by the big nationals.
Right. Right.
We can get into that later, but it's a byproduct of competitive bidding.
Right. So private residences, someone live in their own private, home, apartment, condominium. Retirement centers could include a CCRC. It could include independent living,
Yep,
even assisted living.
absolutely.
Yeah. But maybe not skilled nursing.
Well, skilled nursing from the perspective of when they discharge.
Right.
If someone goes to the hospital with a broken hip or whatever it may be, and they go from the hospital to a rehab facility inside of a skilled nursing facility.
Right.
They're there for a week, 2 weeks, a month, whatever, until they're ready to go home. And then that social worker, should they need equipment, will, first of all, they'll give the patient a choice. Do you have any preference of which DME company to use?
Right.
Oftentimes they don't have a preference. So the social worker will send a referral for whatever that patient needs to go home with.
Right. So payment sources. So I know there's different payment sources out there. Medicare would probably be a big piece. No?
Well, Medicare's probably about a third of our
Okay.
payers, but very, very important.
Yeah.
I mean, very important. If you're not able to bill Medicare, you're really not in the game.
Yeah.
Particularly as seniors are concerned. But Medicare HMOs, Medicaid, obviously private insurances, you know, the big four. And the big four are going to be the big two very soon.
Yeah, really.
Yeah,
They're consolidating as well.
big time.
Yeah.
And that's probably another show, but
Right, right.
it could be a very big deal.
So again, you know, it's a multitude of medical products that DME companies have to offer, but oxygen would be a big one, right?
Oh yeah,
Wheelchairs,
huge.
yeah. What else? Give me some top
Hospital beds,
hospital beds.
support surfaces for those beds.
Right,
If someone is bed bound, they can't make independent changes in body position.
right,
They're just, you know, and they get what we call bed sores. You know, you don't want those.
right.
I mean, so we've got specialty mattresses that will keep people from developing those and will actually heal those. We do negative pressure wound therapy, which most folks have never even heard of, but it's a clever little device. It's a teeny little vacuum that you dress a wound, you put a plastic, for lack of a more technical term, over that, you seal it, you've got a little teeny, like a little cocktail straw that goes under there, and a little teeny vacuum is pulled on that wound, and it just closes the wound.
Wow.
It's amazing technology. It can be used in the home.
Wow.
You can actually wear it and go out
Wow.
to the store. I mean, but those are the kind of things that we do. All kinds of bathroom safety, things as simple as a lift chair.
Yeah.
You know, like my dad, in his final 5 years, he could not get up out of the chair.
Yeah.
And my mother weighed 100 pounds. She couldn't pull him up. Simple solution. Push a button, stands you up.
Yeah.
I mean, but that's the nature of our industry, is to make things easier for people at home.
Right, right. How far does it even go into bathroom tubs and things like that, or is that a separate category?
We've got many different bathroom safety items.
Right.
Something like a transfer bench.
Yeah.
You know, when my dad had his stroke, and by the way, that's why I got in this business.
Really?
Because my dad needed everything that I sell today. I'd never even heard of the DME industry.
Right.
And this was not in Charlotte, and nobody was able to educate me and my family on what my dad needed.
Right.
He couldn't get in the tub. Well, a simple device like a transfer bench, you've got half of it outside the tub, goes over the side of the tub, and you got half in the tub.
Right.
So you can get on the transfer bench in the bathroom, safely lift your legs over the tub and slide over into the tub
Right.
without, a risk of falling. Something like a patient lift. My dad would fall out of the bed or fall, going to the bathroom, nobody there to pick him up.
Right.
Well, a patient lift will pick him up.
Like a Hoyer lift?
A Hoyer lift, yeah.
Yeah.
Hoyer is the brand name, but the generic is a patient lift. I mean, that's what it's for. It's for moving someone from the bed to a chair, or from the chair to the bed, or from the floor to a chair or bed.
I would agree with you on that. Let's make a note of that. Because a lot of people out there in my business, I own a home care company as well, look at spouses or family members in their house and they say, I can't move him or her anymore. They're just too big.
Yeah.
They can't be mobile anymore. So I guess we're going to have to move them into a retirement community, which is an option. But they don't always realize that a patient lift is available to go into somebody's house and an individual, like a spouse, using that machine could lift that person up and in and out of the bed into a chair,
Yeah.
if so needed.
Exactly.
Yeah.
I mean, we have people that come in the store every day, and it's typically a child of a senior who, for whatever reasons, they've lost their independence at home, and they come in and they don't know what they want.
Right.
So I just have to ask them questions. Well, can they do this? Can they do that? And then we figure it out.
Open-ended questions.
Absolutely. We figure out what they need.
Yeah. Yeah, because that is the best way. Because a lot of people in our industry that are patients or family members of patients, I think we all see, they don't think about it until an emergency happens, and all of a sudden they need help.
Yep.
But sometimes they don't always know. So coming to a DME provider or other people within the industry, ask the questions, or they can ask you the questions to find out what you need. So
Exactly.
yeah. Why don't we talk a little bit about also the Affordable Care Act and Obamacare?
Well, I refer to that as the Unaffordable Care Act. Prices have done nothing but go straight up since
Right.
its inception. But it has changed access to medical equipment more than any other single factor in my 12 years of being in this industry.
Right.
And I say that because, that was a piece of legislation that was put into law without, as far as I know, any congressman or senator even reading all of it. I forgot how many thousands of pages it was, but it was done at the 11th hour. Nobody, not even a staffer, had read all of what was in there. And a lot of details are in there about prescriptions, face-to-face requirements for if you need something that I sell and bill to Medicare, the doctor just can't write a prescription.
Right.
A prescription means zero today. It means they're wasting their time even writing it for the most part. The patient, for most items, they've got to have a face-to-face encounter with their physician. And the doctor's got to be very specific about documenting medical necessity for whatever it is he or she is ordering. I'll give you a great example. Last year when the Affordable Care Act kicked in, and I think it was July 1st, 2014,
Right.
we got a prescription for a wheelchair. We had great documentation. Patient cannot use a walker or a cane due to multiple falls, whatever.
Right.
We submitted all that to Medicare and we were denied because the physician did not say manual wheelchair. Now we billed that as the lowest possible code of wheelchair. Statutorily denied.
Really.
So those are the kind of issues that we face. The doctor's ordering a hospital bed. He can have, a page of documentation. And of course they want a semi-electric. They want to push a button
Right.
and have the head of the bed raised up with the feet. And if he or she does not mention the word frequent or immediate changes in body position, it's not paid.
Right.
Again, it's statutorily denied.
Right.
It's, back in the day, they used to just to downcode it or something, or you could appeal it to, you got 3 different appeal levels. Now, the only appeal that we have is to the same people who can't exercise their clinical judgment. These are nurses and doctors doing these appeals, but they're not allowed by Medicare to use their judgment. They can't use any clinical inference. So after you finish with those, then you can go to an administrative law judge. They've got over 10,000 claims, they're behind. That's years. And to put that in perspective, we've never lost an appeal at that level in 12 years because they can use their judgment. It's
But
like,
it takes a long time.
I'm not trying to make my problems your problems, but it's just, it is what it is. I mean,
Right.
the Affordable Care Act's a big deal.
So that's something you've probably been involved with because you deal, right, Chad? You know, because you're
Absolutely.
dealing with doctors' offices on a day-to-day basis trying to get physicians to write things out.
Absolutely.
And what are they doing? You're going in there to get the physician to sign off on an order for a DME product?
Basically, but no longer is it sales as usual. We find ourselves being more of educators now. You know, these doctors now, physician assistants, they're expected to see a certain number of patients in a day. They've got a quota that they've got to meet.
Yeah.
So they don't have time to stay up on all of the ins and outs of what Medicare is asking for, especially calling a hospital bed what Medicare requires it to be is a semi-electric hospital bed. So we find ourselves as account executives going around and educating these physicians on, listen, doc, you got to have a face-to-face that says this specific information, and then you have to have a detailed written order that includes these certain items, or else Medicare is not going to pay for that piece of equipment.
Right.
And you hope that they're going to receive that information well, but most of the time they're irritated. And it's trying to find that common balance. It's very, very frustrating for the patient.
So if I'm hearing you correctly, you would recommend probably that if one of our viewers needed a DME product, first to inquire through the social worker to get to a company like yours, and then before they ask their physician to write up an order, maybe to ask the proper wording, right? That needs to be on that order, or what do you suggest?
Well, Chad said it, he hit the nail on the head. We don't sell anything anymore.
Educating.
We educate.
Right.
And the order is a byproduct of the education that we've done.
Yeah.
That's all we do. And we're chasing documentation constantly.
Right.
It's, again, a prescription means nothing.
Right.
I wrote a blog on that 2 years ago. Little did I know it was a lot easier 2 years ago than it is today. It's a challenge. It really is.
Yeah.
But that's what we do. That's all we do, and we're good at it.
Yeah.
So you have to be to stay in business.
Well, and let's talk about that, because for the Charlotte market, where most of our viewers are watching from, and/or the surrounding areas, Carolina's Home Medical Equipment and other companies like you can service this market. But let's talk about the Charlotte market in particular, because bidding has taken place. Medicare came in and looked at certain markets, and Charlotte was one of them, as a bidding area. So tell me what that means. Tell our viewers what that means and how it
Okay.
impacts them and the industry as a whole.
We've been in the bidding business for a little over 4.5 years. Charlotte was one of the first 9 cities in the country chosen as the first demonstration project, if you will.
Right.
And so we've been doing this for quite some time. The contracts are only good for 3 years. So we're in the second round of bidding now. We're halfway through that. The result of 2 rounds of competitive bidding is our reimbursement has been cut by around 50% on most every single category. That's a big deal. I mean, when the government takes a 2% cut, they're on TV, Obama's on TV, and the government's going to shut down because their budget got cut 2%. I said, really? 2%? You shouldn't even miss 2%. But yet they want us to take 50%. So what's happened? How do we deal with that? Our volume has gone up 400%.
Right.
You have to get bigger trucks. You have to make it up in economies of scale. So we've seen lots of companies like mine fall off, either go out of business or be sold to a large company because they just couldn't do it. And now competitive bidding is being rolled out into rural America January 1st next year.
Really?
And those poor folks don't have any chance of getting additional volume. They've got zero chance of success. Zero. No, there's no chance they can make it.
Yeah, even me. I mean, I'm not in that specific industry, but I can't help but wonder the process and the logic behind it. So the federal government said, okay, we're going to reduce the number of providers by making it a bidding situation, reduce the pricing, but instead of one company who can provide almost any home equipment product, anything across the board, then they say, correct me if I'm wrong, here's of all the home equipment products that are out there, you have to bid on every single item individually, and then Medicare will select you based on your price and service
For that category.
for that category.
Yep.
You may get one, you may get 10, you may
Exactly.
get 2.
Might get none.
And what I was amazed at was how many companies 3 years ago that didn't even have an office in Charlotte that won the bid
Well, I'm glad
for Charlotte.
I'm glad you brought that up. I mean, we've got companies in California, Texas, Florida that won contracts, multiple contracts in Charlotte. They have zero bricks and mortar. They got nothing. And we also people bid in Charlotte, saw the number, bid from all over the country.
Right.
Saw the number and said, "Nah, I'm good. I'm not going to accept the bid." But yet their lowball number was used
Affected everybody
to
else.
calculate the price for Charlotte, which is just insane. But we've got some legislation in the works that, in fact, I'm having lunch with Senator Burr. We're having a fundraiser luncheon for him Wednesday. And he's going to help us.
Good. All DME companies.
It will help all DME companies in the whole country,
Right.
not just Charlotte.
Right, right.
I mean, this is a big deal.
Yeah.
And we've got to have our Congress engaged, and they got to understand exactly how crazy this stuff is.
Yeah, yeah. So January 1, it goes to the rural areas, which is that rural areas even in North Carolina as well?
Oh, yeah.
Yeah.
Nationwide.
Okay.
Nationwide.
Wow. So that's going to be a complete flood.
Well, people have been predicting that competitive bidding was going to be the downfall of the DME business. You know, I didn't necessarily prescribe to that doomsday theory, but because we've done quite well
Yeah.
with it. But the rural thing is a whole different ballgame
Yeah.
because they can't make it up with increased volume.
Yeah, because
So-
they have the distance to cover between clients is so dramatically
Yeah.
larger.
Yeah, I took a fishing trip in Montana this past spring. You might drive 30 miles between houses.
Yeah.
I mean, and as I was driving, I'm saying, God, what are these DME guys going to do? Now, Medicare thinks Anson County is metropolitan. You know, it's halfway to the beach. It's, you know, you've got to take your logic out of the equation when you're talking about Medicare at times. It's some things just aren't logical. But they do have a trust fund they've got to protect.
Right.
And they're out of money. So they're doing things that I call desperate. But
Right.
I mean, I get it. I understand they're trying to save the benefit. But we're 1%. We're slightly under 1% of the Medicare budget. If I were them, I would look at the low-hanging fruit on the 99%.
Right.
Instead of picking on the DME industry. I don't mean to be parochial,
Right.
but we're under 1%, really? Why would you spend so much time? Why do you have these hundreds and hundreds and hundreds of auditors and stuff hawking us when you could get the low-hanging fruit off the 99%?
Right.
That's
Right.
where the issues are. That's where the big money is. But I'm not in charge of Medicare.
Let me go back a little bit, because a lot of what I see a lot, the big ticket items are more complicated. DME products, it's easy. Medicare or third-party insurance will cover X percentage of. But what I've been a little curious about is, where does the third-party insurance and Medicare not always pick up? At what level? For example, in a bathroom, does a bedside commode, is that covered? That's a pretty small item. Ticket,
Okay.
I mean, is that out-of-pocket expense?
Medicare does not pay for any bathroom safety.
Okay,
Simple as that.
okay.
Medicaid does.
Okay,
Medicare doesn't. Medicare will cover a bedside commode if the patient is room confined, and we've got documentation that says that.
gotcha. So if a patient or their family members aren't sure, they should go through the social worker or just call up the DME company
Sure.
directly
Yeah.
and say, here's the circumstances.
Yep.
I'd like to ask your opinion on whether
Sure.
or not this would be covered by Medicare or third party, or I got to pay out of pocket,
Yeah.
right? And do usually DME companies, are they allowed to sell cash basis as well?
Oh, yeah.
Yeah,
Sure.
they can do that as well. Or they could go to a Walmart or
Exactly.
whatever nowadays. It
Yep.
seems like that's going that direction as well. Well, good. Where do you see things heading moving forward in the DME industry?
Well, I think the big guys will get bigger, and the small guys will go away.
Yeah.
As sad as that is, because nothing against the big guys, but the mom and pops do provide a very high level of service, something I call in my company extreme service. Not good service, not very good service.
Right.
Extreme service. Big difference.
Well, that's how you can distinguish yourselves, as you've done for many years in the Charlotte market, between you and your competitors in the DME industry. DME, durable medical equipment, which is home equipment services and home equipment products throughout the region. Very, very important in our field for seniors and family members. Certainly something that everybody needs to consider. I think if any of our viewers or their family members have questions, they certainly can ask more questions by calling up people like yourself at Carolina's Home Medical Equipment and ask these type of questions. Thank you very much for all the viewers that watched tonight. Frank and Chad, thank you for
Thank you.
coming today, this evening, and we will see you on the next show of Aging with Attitude. Thank you.